The Damiano Center provides essential services to individuals and families who express assistance. Damiano welcomes those in need and without judgment. Their goal is to be responsive to the needs of people who are low income, working, and unemployed in the community. The center is an excellent steward of resources that offers 6 different programs. Community Kitchen, which provides 13 free meals each week to community members. Kids Kitchen, which is a drop-in program for children ages 6 to 17. The Free Store, which collects donations from the public, gives community members an opportunity for them to get clothes and for them to get clothes for their family. Community Service provides referrals, community resource information, along with hygiene and household items. Health Realization is a cognitive skill building program provided for the community, men only, and women only. Clothes That Works is a program that offers business apparel for interviews or employment.
Some community strengths we have recognized for the Damiano Center are strong volunteer support from various members of the community to keep the Damiano Center running, the cleanliness and well-kept environment that the Damiano has, and a welcoming environment and friendly faces that accept everyone that enters the door without judgment. Some community needs we have identified for the Damiano and surrounding community are the lack of affordable housing, the need for support services for things like mental health illnesses, need for transportation, lack of affordable health care, as many have mentioned that it can be difficult finding providers that accept Medicare and different health insurances. Based off this information, we have determined the social determinants of health are as follows: education, healthcare, access to safe housing, and unsafe surrounding environment.
At the Damiano Center, family dynamics are very important. Those who are able to be around their biological family don't let that opportunity pass. Many large families are seen receiving services throughout the Damiano, including large extended families who all stick together. Those who do not have their given family around make a chosen family. Those individuals come together at the Damiano Center to make their own support systems. The overall environment at the Damiano Center is very welcoming to children. Not only are there services for children, but other services and staff are very aware that families and children are constantly coming in and out of those doors. Families of all sizes and origins are welcomed into the Damiano Center inclusively.
Our nursing diagnosis for the Damiano Center is ineffective health management related to lack of education, limited resources, and low socioeconomic status, as evidenced by high rates of homelessness, mental illnesses, and poor hygiene.
An intervention that was put in place to support our nursing diagnosis is the conduction of surveys through events such as Community Connect. Evidence supports that individuals who receive government assistance through facilities that receive grants and funding like the Damiano Center have been able to come out of poverty. Programs that are available include SNAP, ETIC, CTC, and Medicaid support. These are programs that the Damiano Center works with for people who are in need of government funding dollars. Our SMART goal is biannually surveys will be conducted in Central Hillside to determine the amount of funding the area receives for community resources.
Our second intervention is to implement pop-up wellness clinics. These checkups would include interventions such as gathering vital signs, skin checks and foot care, as well as gathering any other data using the PQRST assessment questions. After assessing their overall general health, student nurses would provide suggestions regarding their assessment findings for further treatment. Our SMART goal for this intervention is student nurses will conduct pop-up wellness checks every 3 months to assess individuals' overall health, wellness, and coping skills.
Our final intervention is an IADL education class. IADLs are slightly more complex skills. They include managing finances, handling transportation, shopping, preparing meals, basic home maintenance, and housework. Learning to manage these complex skills will help individuals prosper in their life and the community. Evidence shows that nutrition education classes had a significant improvement in those who were diagnosed with cardiovascular disease. Our SMART goal for this intervention is community members will attend classes run by student nurses to gain basic knowledge regarding independent activities of daily living. It was a privilege to work with the community members of the Damiano Center. We all look forward to applying interventions in the fall, and here's a look into the inside of the Damiano Center and some of the lives it has impacted.